Hello medical students. In this video, which is first videos for medical students, we will discuss about the how to read any medical textbook effectively. So first, when you start reading any medical textbook or when you start reading any medical subjects, there are three phases of reading which is very important. First one is pre-reading phase, second is reading phase, and third one is post-reading phase. So in pre-reading phase, book selection is very important. Now which book you are going to read, and second is when to read. Now then with music on or off, there are many things which comes to your mind, or there are many queries which must be answered before you start reading any subject or any medical textbook. So in this sequence wise, I'll answer these questions, these queries of the medical students. So first, book selection. So I'll answer this question, this query prof wise, subjects of first prof, then second prof, then third prof part 1, then third prof part 2. So basically any medical textbook you should read standard medical textbooks, not the books which people read to pass their exams. So and try to read the international textbook, though there are exceptions in few subjects where Indian textbooks are very standard. I'll start with anatomy, and in anatomy the standard textbook which everyone should read is Gray's Anatomy. In Gray's, though most of the people, even most of the medical students in Indian subcontinent read BD Chaurasia, but Gray's is standard. In Gray's, the anatomical photographs which are given different views of the anatomical photograph are given. Anterior, posterior, then transverse. These helps in reinforcing what you read in the text of the subjects and helps us remember the concepts for long time. As you know, any picture, any image speaks 1,000 words. So in this respect, Gray's Anatomy is at an extra edge over other anatomy textbook. In topics like that are quite theoretical, example GIT organs, liver, pancreas, spleen, BD Chaurasia is very good. You should read anatomy abdomen portion from BD Chaurasia. For biochemistry, there are three books which are commonly read by medical students in the Indian subcontinent and even worldwide. Harper's Biochemistry, then in India Vasudevan Biochemistry, or Lippincott. Now Satyanarayan is worst biochemistry book no one should read, because Satyanarayan if you compare Vasudevan and Satyanarayan, what Satyanarayan has read in 1,000 pages, Vasudevan has concised that in 600 pages, 500 to 600 pages. Satyanarayan has just used English words to write what Vasudevan has written in one line. Satyanarayan has used 4 to 5 lines to write that thing only. So better, and reading Satyanarayan textbook of biochemistry is just wastage of time. So either you can read Vasudevan or Lippincott or Harper. Harper is quite complicated. Now if you are in first prof, then Harper is very difficult to comprehend. So I will suggest read either Vasudevan or Lippincott. In Lippincott, metabolism portions, especially metabolism cycles and charts, are very good. You should read them, and even try to include that in your answer, especially the flow chart tables they have included in their metabolism chapter, almost in all chapter, but especially metabolism part is must to read from Lippincott's, and Vasudevan is overall a good book. Then physiology. Coming to physiology, there are 4 books which are read in these Indian subcontinent. Ganong's Physiology, Guyton Physiology, and third one is Ekigen or Samulingam in many states people read. So I would suggest read Ganong cover to cover. Ganong is very good book. And if you want to read Guyton, then read only CVS chapter. CVS and ECG part has been written quite lucidly in that book. And for passing exams, you can read important topics from either Samulingam or because they have presented in a way that the examiner expects us to write answers in the exam, in the university exam. So you can use AKZN physiology textbooks, or you even Nutsel physiology textbook is very good for exam purpose, or Samulingam or AKZN for exam. So read Ganong as your standard textbook. Read cover to cover that book. Coming to second prof, in Robbins, no book should be read except Basis of Pathology, Robbins textbook. Now there are two Robbins. One is Big Robbins. Read Big Robbins. Baby Robbins is not good. And third one is Pocket Robbins. Pocket Robbins is for exam purpose only. Okay. Then microbiology. In microbiology, you should read Anant Narayan textbook about microbiology. Bhaveza is useless book. Never read that. Bhaveza has been written for as a revision textbook, revision book for university exam. So never read Bhaveza. Anant Narayan is very good book. Prefer Anant Narayan. And for immunology part, you can read Javed's. I have read most of the chapters of Javed's textbook of immunology. That is very good. And for forensic, you should read one and only one book. That is essential to understand the concepts of forensic medicine. That is Reddy, K.S. Narayan Reddy textbook of forensic medicine and toxicology. And never read Gautam Biswa. That is worst book. That has been written in a way that you are going to mug up the things. That hasn't cleared the concepts. Reddy has been written in a manner that will help you to grasp the basics of forensic medicine, and consequently helps you to apply the concepts of forensic medicine while you are practicing medicine. And forensic medicine is very important subject as far as a practicing doctor or a registered medical practitioner is concerned. And after this, pharmacology. In pharmacology, you can read Lippincott pharmacology, or you can read Lippincott pharmacology, or K.D. Tripathi is also a very good book, or you can read the PG exam book which people use for PG preparation by Govind Rai Garg. That is very good book. Either use GRG or use K.D. Tripathi or Lippincott. Many people read the another one big one books that is not important for that is published by, probably I am forgetting the name, that is not important for UG students. You can choose any of the three books, any one of the three books, either GRG or KG Tripathi or Lippincott. Okay. After this, third prof. In third prof, PSM, only Park should be read. Use Park, but never substitute your Park with any book, for example Vivek Jain or anything, because reading Park will take time, but you will develop concepts. Your conceptual clarity will be very good. So read Park only. Then ENT. In ENT, you can use either Khurana or Parsons, but in ophthalmology, you can use either Khurana or Parsons, but Parsons is a comparatively good book. And in ENT, one and only one book used by medical students in the Indian subcontinent is Dhingra, textbook of ENT by Dhingra. Use that books. In final prof, generally medical students become more serious in the final prof. So in final prof, you can use I should suggest read Harrison's textbook of internal medicine, the big one for your medicine. That will develop you to that will help you to develop concepts. Though it is very lengthy book, but read important topic that are asked in your exams, or important topics that are clinically more important. read that. You have 1 year, or if you people you start reading medicine from the second prof onwards or third prof part 1 onwards, so you have 2 years time. You can almost read 50 to 60% of the Harrison's book. And never read Davidson. I will not suggest you to read Davidson. Davidson is not a good book, is not better compared to Harrison. Read Harrison. In my college and hospital, almost 70-80% of the my batchment used to read Harrison, and Harrison is a very good book. For exam purpose, Harrison will not suffice. For exam purpose, you can read a manual, exam manual. No? Different exam manual. I mean, you can read anyone. In surgery, read Love and Belly or SRB's textbook of surgery. You can read any one of any of the two. Especially if you are reading Love and Belly, then 2 units must be read. GIT and urology are must to read from these. GIT, urology, and breast. These 3 units must be read from Love and Belly. Coming to gynecology and coming to obstetrics and gynecology, in Ops, Datta textbook of obstetrics by Dr. Datta is a very good book. And in gynecology, Datta book is not good. Different book which we read, I'm forgetting its name. Datta is not good. Another one which people read for gynecology, so you can read. And in pediatrics, OP Ghai is read by most of the medical students in Indian subcontinent. And for Dhamma, we used to read Nina Khanna. Nina Khanna is a good book. And in psychiatry and anesthesia, no one read any textbook, just read from the notes. Now, and these all are the books means you should read. Coming to now we have done the book selections. Coming to when to read, so people the time in which there are less, the time of the day when there are less distractions, you can read. It can be day or night, na? So people ask me with music on or off. That is also your personal choice, with music on or off. I couldn't concentrate. During my pre-medical preparations, I used to solve physics and chemistry with music on, with earphone on. But reading medical textbook with music on is very difficult for me because I couldn't concentrate. Now, so it is your personal choice if you can concentrate. But I would suggest ki read medical textbook without any music, because they need you to have the full concentration. With music on, you may get distracted, or loudly or silently. If you are in home, if you are in alone, or you are alone in hostel, you can read loudly because it will involve most of your senses, not your vision, your auditory senses, will be involved, and it will improve your retention. But if you are reading in library, you can't read aloud, so you can read by speaking the lines is with low volume, so that a person sitting adjacent to him might not get disturbed. And then use multiple color pens or markers to mark the important line. And in the process of marking lines, we have a tendency to mark the whole paragraph. That should not be done. And one thing I would like to tell, in any medical textbook, boxes either blue or pink are very important. You can revise. What I have observed, you can revise all the chapters of any medical textbook, be it Robbins or Harrison's, anything, just by reading the after one reading you can revise the chapter just by reading the boxes. So this is very important. Read boxes, give due importance to all the boxes given in any medical textbook. Similarly, for Harrison, you can read the tables, charts, algorithm are very important. And what I have seen reading manual of any standard textbook. For example, if you have gone through the Harrison's textbook of medicine, then you can easily comprehend or easily revise for your university exams, for any other exams, or even for many of your objective exams, just by going through the manual of that. For example, Harrison's manual of medicine will help you in revising medicine if you have gone through the standard textbook. If you have read standard textbook, then keep these tips also in your mind while studying any medical subjects. Okay, then coming to next phase, reading phase. So while reading any textbook, underline the important words or underline the keywords in any for understanding any concepts. Try to understand any key words. Now, keywords that will help you to answer the questions in the exam too, and also in remembering the concept, retention. It will improve your retention. And what I would like to suggest that always understand the meaning of each words. Always understand meaning of each medical words, medical terms. Example, if there is apple core, you should understand what is exactly the apple core. There is radiological sign, apple core sign now, and then any radiological sign, any radiological term or any medical term, you should understand the English meaning of that at first. This will help you in remembering, instead of just mugging it. Okay, this is seen in this instance. Okay, note making should be done either separately or on the textbook. If there is a space, then you can make the notes in the textbook itself. That will keep both notes and textbook at one place and help you in revising. And it will save your time in opening your notes, and especially in the last day, especially during last week or last day of your exams. Draw diagrams. This will enforce your concept. What has been written in theory, try to mention it in algorithmic form in the notes. Now, I always used to write the answers in my exams, my university exam, in the algorithmic way. This saves my time, plus it gives better presentation. Even if you I'd like to tell to you that if you are a doctor, if you are a medical student or a doctor, and you are going to write UPSC mains, then in that exams it is very important to write the answers in the algorithmic way. So start practicing in your UG days only, and make flowchart. These all, and there are many audiobooks of standard textbook. For example, Robbins Pathology, Harrison's Pathology, which you can use while traveling, while going to your medical college, or while going to any classes in the while you are traveling in metro or any other cab. You can use the audiobooks. Just download it and you can switch it on with your earphones on. Or you can even with the audiobooks on, you can read the medical textbooks, so there will be better reinforcement. Now, line to line, what you are listening, you can read it. There are few audio books also. For example, Goslan's Pathology, you can also use. Read any diagram of in any medical textbooks. With proper understanding of all the labelings. That is very important. What I have observed, many MCQs in any competitive exam, PG entrance or MLE exams, are directly picked up from the diagram of the standard textbooks. So read with proper care of labelings in the medical diagrams. Okay, and the post reading phase, I'll say that use notes. And revise the concepts frequently. Try to link, means while reading the textbook itself, if you are reading anatomy, if you are reading anatomical positions, never read anything without understanding its implication. Why I am reading, why it is, how it is useful as a doctor. For example, why we are reading anatomical position. First thing we read after just getting admitted in the medical school is anatomical position of bones. Why it is important? Why it is important to know anatomical position of the in every concept you are reading. Why it is important to know the cardiac output. Why it is important. So try to read any concept application wise. First, try to know why it is, why I am reading it, na? Why, where it has its applications. If you read this way, it will help you, it will kindle your interest too, plus it will help you in retaining the concept, in proper retention, in retention of the concept for the longer time, plus it will increase your interest in reading that also, instead of the why I am reading forensic medicine, what's the important if you are studying any medical textbook or medical subject, just try to try to think why I am reading this. And besides this, do slight simple research. You can use YouTube or Quora for finding how to read forensic medicine or how to read pharmacology in a better way, huh? So that will also be very useful. Now, or I'd like to say to you, make a routine of reading. You can read, develop your mind so that for reading, make a separate routine for reading. If you are if you feel comfortable in reading in morning, read in morning every day. If you are comfortable in reading in during night, late night, then make a routine that will help your brain to easily adapt to the things, and your retention will improve. Now, or there are few things left. I'll try to summarize that also. But and while reading, read slowly, not very fast, because slowly understanding the meaning of each word, linking the previous paragraph with the current paragraph, and applied in. For example, if you are reading pathology, try to correlate it with physiology, huh? Physiology. If you are reading histopathology slides, then try to relate it with histology slides which you have read of that tissues, huh? That will help you in becoming a good clinician. Try to correlate what you are reading in pharmacology with forensic medicine. Try to correlate what you are reading in pathology with microbiology. Now, try to correlate what you are reading, what you have read in anatomy with surgical anatomy, or in surgery. What you have read in anatomy with ENT, ophtha. Try to do in this way. And these all are just. And in fact, while from second prof you have started your clinical postings, try to apply, try to see the cases. For I would like to tell you, for clinical cases, for clinical postings, for surgery, use S. Das or MLS, Makhan Lal Sahai book of practical books of clinical cases. And for medicine, use Hutchinson or Anant Narayan. Hutchinson is a standard book. Must read Hutchinson, and you can use Anant Narayan also. Sorry, Anant Narayan, Algappans, what I am saying. Use Hutchinson's or Algappan textbook of clinical medicines. In pediatrics, you can there are 2-3 books which you can use. For gynecology, choose the standard textbook of Obs and Gynae. So what I want to stress here, that what you have read, try to apply in the clinics if you have, and if you are going to see a anemia case in the clinics in gynecology, in obstetrics and gynecology, read anemia at home. Now, this helps you. Then okay, all the best for your journey in this field of medicine.